Hello friends, welcome to Creative Medicine. In this lecture, we will learn about. Hello friends, let us now learn the list of the drugs causing hyperkalemia. Drugs causing hyperkalemia. Drugs causing hyperkalemia include ACE inhibitors, cyclosporin, succinylcholine, amiloride, cytotoxics, digitalis overdose, heparin, lithium, NSAIDs. These includes pentamidine, including salt substitute. This also includes potassium salts of drugs, spironolactone, tramterine, trimethoprim. Thank you for watching. Thank you for watching.